Westab Plus 27 mg Iron-1 Tablet Multivitamins are used to treat or prevent vitamin deficiency due to poor diet, certain illnesses, or during pregnancy. Vitamins and iron are important building blocks of the body and help keep you in good health. The recommended daily dosage is usually 1 tablet, and it is best to take it with food to help with absorption. It is important to take this medication at the same time each day to help you remember. Always follow your doctor's instructions for the best results. It's important to take this medication by mouth, usually once daily or as directed by your doctor. Make sure to follow all the directions on the product package. It's best to take this medication on an empty stomach, 1 hour before or 2 hours after meals, with a full glass of water unless your doctor tells you otherwise. If you experience any stomach upset, you can take this medication with food. Avoid taking antacids, dairy products, tea, or coffee within 2 hours before or after this medication, as it may decrease its effectiveness. After taking the tablets or capsules, avoid lying down for at least 10 minutes. If you are taking the delayed release form or extended release capsules, make sure to swallow them whole without crushing or chewing. Take this medication regularly at the same time each day to get the most benefit from it. If you experience constipation, diarrhea, or upset stomach, it may be temporary and could go away as your body gets used to this medication. If these effects persist or worsen, contact your doctor or pharmacist. Taking iron may cause your stools to turn black, but this is not harmful. Remember that if your doctor has prescribed this medication, they have determined that the benefits outweigh the risks of side effects. Many people using this medication do not experience serious side effects. Although rare, if you notice symptoms of a serious allergic reaction such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. In the US, you can call your doctor for medical advice about side effects or report them to the FDA. In Canada, you can also call your doctor for medical advice about side effects or report them to Health Canada. It's important to note that accidental overdose of iron-containing products is a leading cause of fatal poisoning in children younger than 6 years. So, it's crucial to keep this product out of reach of children. If overdose does occur, it's important to seek medical help right away or call a poison control center. Before taking Westab Plus 27 mg Iron-1 Tablet Multivitamins, it's important to consider a few things. Let your doctor or pharmacist know if you are allergic to any of its ingredients, or if you have any other allergies. This product may contain inactive ingredients, such as soy, which can cause allergic reactions. It's also important to discuss your medical history, especially if you have iron overload disorder, alcohol use/abuse, liver problems, or stomach/intestinal problems. If your multivitamin contains folic acid, be sure to tell your doctor if you have vitamin B12 deficiency before taking it. Before having surgery, inform your doctor about all the products you use. If you are pregnant or breastfeeding, consult your doctor before using this medication. It's important to be aware of potential drug interactions when taking Westab Plus 27 mg Iron-1 Tablet Multivitamins. This can affect how other medications work and increase the risk of serious side effects. Be sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medications without consulting your doctor. This product can decrease the absorption of certain drugs such as bisphosphonates, levodopa, penicillamine, quinolone antibiotics, thyroid medications, and tetracycline antibiotics. It's recommended to separate the doses of these medications as far as possible from your doses of this product and consult your doctor or pharmacist for help finding a dosing schedule that will work with all your medications. If your multivitamin also contains folic acid, be sure to inform your doctor or pharmacist if you take certain anti-seizure drugs. It's important to note that this medication may interfere with certain lab tests, potentially causing false results. Make sure to inform lab personnel and all your doctors that you are using this drug. If someone has taken too much Westab Plus 27 mg Iron-1 Tablet Multivitamins and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. Symptoms of overdose may include stomach pain, nausea, vomiting, and diarrhea. If your doctor has prescribed Westab Plus 27 Mg Iron-1 Tablet Multivitamins, it's important not to share it with others. It's also important to keep all medical and lab appointments while taking this medication. Some brands of this medication may also contain ingredients such as docusate. If you have questions about the ingredients in your brand, be sure to ask your doctor or pharmacist. Remember that this product is not a substitute for a proper diet. It's best to get your vitamins and minerals from healthy foods. Be sure to maintain a well-balanced diet and follow any dietary guidelines as directed by your doctor. If you forget to take a dose of Westab Plus 27 Mg Iron-1 Tablet Multivitamins at the scheduled time, take it as soon as you remember. If it is close to the time for your next dose, just skip the missed dose and take the next one at the regular time. Do not take a double dose to make up for the missed one. When storing Westab Plus 27 Mg Iron-1 Tablet Multivitamins, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom, and always keep them out of reach of children and pets. When it comes to disposing of this product, it's crucial not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, make sure to properly discard the product when it's expired or no longer needed. If you're unsure of how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.